Hi, hello everyone. Hello everyone. Welcome to Forensic Friday series with FMT Guru. In this series, we're talking about FMT practicals. So in today's session, I'm talking about wound certificate and weapon examination and weapon examination. As you know, it is a very important exercise or must know exercise in your FMT practicals. It's a medical legal document. You must know how to write correct injury or wound certificate, how to give opinion, what are the parts of the injury certificate, all this you must know. So in this session, we are discussing how to write correct injury certificate, also known as wound certificate. What are the parts of injury certificate? What are the classes of grievous hurt? Briefly. And weapon examination pro forma. Lastly, few important Viva voce questions. Let's see what are the parts of the injury certificate. Injury certificate, also known as wound certificate, in your exam, as per CBME syllabus, it carry 10 mark. Injury certificate 10 mark, weapon examination around 5 mark. Around 15 marks for this exercise. What are the components in general? The first one, general particulars. You need to write general particulars of the victim or the patient, that carry half mark. Then briefly about alleged history, that carry 1 mark. Consent, marks of identification, general physical examination and examination of injury, which is known as essence of injury certificate, that carry 4 marks. Investigation and opinion, that carry 2.5 marks. So all these are the components in general about injury certificate. Let's see. This is the common injury certificate or the wound certificate we follow. Let's see how to write injury certificate. You can see here injury certificate starts with the some details of the patient. Before that, there is something known as MLC number. You need to write MLC number. What do you mean by MLC? Medico legal case. Okay, MLC number. You need to write some MLC number given in the pro forma or the exercise. Then name of the hospital, OP number or IP number, date of admission and date of discharge if it is given, name of the patient, sex, age, address, brought by police constable or the attendant. You need to write the details of the attendant. And very important is the consent. So it's a medico legal examination. You need to examine the patient only with the consent. Like it is written consent, written informed consent. You need to write identification marks, at least 2 identification marks. Like example, scar or mole or birthmark. So any 2 identification mark you need to write in the injury certificate. 1 and 2. Then briefly about the history. So in the history, you can write the word alleged history. alleged history of road traffic accident at particular place, particular time, and a particular date that you can mention. Sometimes history is given by the patient if he is conscious. If he is not conscious, then you can take the history from the accompanying person. You can write the name and relation of the person. So you need to write alleged history. So all this about the preliminary details and the consent and the identification mark. Sometime in exam the question can be asked how to write consent, the exact word related to consent. You need to write this classical or the common words. I, you need to write I, that is the patient name, son of, with a complete consciousness, free will, without any pressure, give consent for medico-legal examination, that is the injury certificate. I have been clearly explained about the examination and the results and findings could be in my favor or against. So this is the proper consent that should be taken while writing injury certificate or while preparing wound certificate. You need to take the signature or the thumb impression. This can be asked. What type of consent it is? It is a written consent. Okay. Now about the details of injuries. Details of injuries, very important. You need to write proper details of the injury because it's very important, very commonly asked in the exam. Before that, one line. A person was examined me on date. You need to write the particular date, AM or PM. Found the following wounds. This is the standard performer. You need to write serial number, type of injury, dimension, location, time since injury, type of trauma or object, remark line. You need to write the serial number 1, 1, 2, 3, 4 like that. Type of injury. What are the types of injuries you know? Mechanical injuries broadly classified into blunt force trauma or they caused by the sharp force trauma. As you know, abrasion, bruise, laceration, they are caused by the blunt force. Stab wound and incised wound, they are caused by the sharp force. With the right type of injury, like example, abrasion or contusion that is given in your exercise. Then you need to write the dimensions. Dimensions like length and breadth. Abrasion is a two-dimensional injury. You can write particular length and particular breadth. But in case of laceration, in case of stab wound, in case of incised wound, you need to mention depth also. How to mention the proper depth? Anyone can you guess? Remember, the proper way of mentioning depth is whether it is skin deep or muscle deep or bone deep or cavity deep. This is how you should mention. A laceration 4 into 2 centimeter, muscle deep or cavity deep, like that, or bone deep. When bone is visible, it is bone deep. So depth should be mentioned in this terminology. Then location. While mentioning location, avoid anatomical terms. Instead of using anterior and posterior, you mention it as front of the body or the back of the body. Instead of mentioning medial part or the lateral part, you mention inner aspect, outer aspect. So avoid medical terminologies as much as possible. That is about the location. Then time since injury. Very important component. It's all based on the color change that you need to study in the theoretical classes. Like abrasion, color changes, contusion, color changes. Time since injury, whether it is fresh or dash day duration, 1 day, 2 day, 1 week duration, like that. Then type of trauma or the object, whether it is blunt force or it is sharp force. Like abrasion caused by the blunt force, contusion caused by the blunt force, incised wound caused by sharp force. Then also you need to mention remarks. Remarks, you can write any further examination. Like example, laceration is there over the forearm. There can be possibility of fracture of the underlying bone. In that you can write X-ray is needed or CT scan is needed, like that. So details of injury should be mentioned in tabular form. A tabular form consists of serial number, type of injury, dimensions, location, time since injury, type of trauma or object, lastly the remarks. So this is how you should write proper injury certificate. Tabular form. Then investigation done. So what investigation? You can mention any investigation required, like X-ray is required. If head injury is there, CT scan is required to rule out the hemorrhage. So investigation that you can write. Finally comes is the opinion. Opinion. In opinion, what you must give? You must give opinion about whether they are simple injury or they are grievous injury. This is important. Simple injury or grievous injury. Because it's a medico legal document. The quantum of imprisonment is decided by the magistrate on the basis of injury on the body. Okay, like example, grievous injury, it is punishable under 325 IPC. The punishment is 7 years of imprisonment. If it is a simple injury, the punishment is around 1 year of imprisonment. That's why you need to write whether they are simple or they are grievous. The grievous means more is the quantum of punishment. So that is the point number 1. The point number 2, you need to write the duration of the injury, whether they are fresh or 1 day, 2 day or 1 week duration, and the weapon that is used, sharp weapon or it is blunt weapon. Because again, the quantum of punishment varies depending upon the weapon. If it is caused by dangerous weapon, then the punishment increases. So opinion consists of 3 important lines. What are 3 important lines? Simple or grievous. Second important line, duration. Third important line, that is about the weapon, whether it is a blunt force or the sharp force. Then the place and date. You need to mention the place and date of examination. Finally, your signature, name and designation of the doctor. This is how you should write proper injury certificate or wound certificate as per CBME syllabus. It's a basic. Now some more points. Here, all of you please remember, an injury can be simple or it is grievous. It is decided on the basis of status of injury at the time of infliction. It is at the time of infliction, not after medical or surgical intervention. So at the time of examination or at the time of infliction, if it is simple only. If it is grievous only. It is not on the basis of treatment, whether it can be cured or not curable, like that it is. This is the point. This can be asked in your exam. We'll come to know about this at the end. So then wound certificate or injury certificate should be in the own handwriting, not be in the printed form. Be own handwriting with a ballpoint pen. It should be prepared in duplicate. Okay. Overwriting, medical terminologies should be avoided as much as possible. All these are important points about the injury certificate. Then also you need to mention a general physical examination before the proper examination. Like example, consciousness, orientation, pulse, temperature, blood pressure, reaction to pupils. All these are the important components of general physical exam. So this is okay. And sometimes you can use magnifying lenses to examine the injuries. So if irregular margins, then it must be a laceration. Clean cut margin, it must be incised wound. Now some examples for the injuries. Now look at this. There is one important injury here. What is this injury? Can identify this? Can identify this? There is an injury over the body, over the front of the body, that is over the upper part of the abdomen. So what is this? You can see the parallel lines like, right? So this must be graze abrasion. Graze, as you know, abrasion can be scratch abrasion, graze abrasion, pressure abrasion, imprint abrasion. This is classical graze abrasion, commonly seen in road traffic accident. And see, graze abrasion, what is the size? Say around 15 centimeter into 10 centimeter. What is the location? Front of the abdomen, the upper part, that you can write. Caused by blunt object, and they are reddish in color, so they can be fresh in nature, like that. Then look at this injury and identify this over the chest. So this must be contused abrasion. Okay, contused abrasion caused by the blunt object again. What about this? This is classical black eye. If black eye is given, you can write black eye. Then, so this is how you should mention the injuries. Now we are talking about very important component. What is grievous hurt? Very commonly asked. Very commonly asked in your Viva. So once you complete your injury certificate, they ask what do you mean by simple hurt, what do you mean by grievous hurt, like that. So remember, grievous hurt comes under IPC 320 IPC. 320 Indian Penal Code, that is for grievous hurt. But remember, it is going to be changed from June, July onwards. It is going to become Bharatiya Nyaya Samhita, from having a separate class for that. So remember, BNS, something new, BNS. BNS means Bharatiya Nyaya Samhita. That is going to replace Indian Penal Code. So from June, July onwards, we are talking about BNS only. If the question asked about the BNS, your answer should be 116 BNS. The section 116 BNS, that gives definition of grievous hurt. Okay, what is grievous hurt? In general, grievous hurt is one which comes among the 8 clauses. There are 8 clauses are there. How many clauses? 8 clauses. Let's see what are 8 clauses. Very commonly asked. 8 clauses. What is the first clause? Can you guess what is the first clause? The first clause is known as emasculation. Okay, emasculation. Remember, emasculation, it is applicable only to the males. Okay, this clause applicable only for the male sex or the males. What do you mean by emasculation? Taking away the masculine power of a male. Like example, penetrating power during intercourse. In simple word, it is the masculine power, that means penetrating power during intercourse. Whenever damage to this emasculation, it can be grievous hurt. Let's see what are example. Like example, cutting of penis, The cutting of penis leads to emasculation. It comes under class 1 as well as class 4 also. Castration or injury to the testis or injury to the spinal cord at a level of L2, L4. As you know, erection, ejaculation. So, erection is due to parasympathetic, ejaculation due to sympathetic. The nerve supply, that is L2, L3, L4. Whenever there is a damage to the lumbar spinal cord, example, assault, okay, or physical assault that leads to a lumbar plexus injury, that can lead to emasculation. So the emasculation is applicable only to males. This is the question very commonly asked in the exam. What are the example? Like example, castration is good. Now, one interesting judgment. So that is between state of Karnataka and Shivalingaya. In that judgment, it is mentioned that squeezing of testicles leading to impotency can be grievous. Okay. This is the first clause. Clause number 2. Remember how to remember clause number 2? 2 eyes. So it is related to vision. But in exam, your answer should be like this. Permanent. Every word is important, okay? Forensic medicine, every word is important. It's a medico-legal subject. Every word is important. So that can be cross-questioned in your courtroom procedure. Okay? Permanent. It is a permanent damage. Privation. Privation means loss. Permanent loss of sight of either eye. Sight of either eye. 2 eyes, either eye. Remember, second clause related to the eye. What are the examples? Like example, corneal scar, or it can be retinal detachment because of the trauma, gouging out of eye, retinal tear. All this comes under, that is class 2. Again, the important point here, it must be permanent. It is temporary? No. Must be permanent. But remember, whether treatable, untreatable, that is immaterial. What is important here? It should be permanent during natural course of the disease. Now we are talking about the class number 3. As you know, in theory classes, class number 3 related to the ear. So you can remember like this. Ear has 3 parts. Outer ear, middle ear, inner ear. 3 parts, clause number 3. Permanent privation of hearing of either ear. Clause number 3. The example is perforation of tympanic membrane. Clause number 4. The 4, remember, it is related to the member. Privation of any member or joint. Again, Viva question can be asked. What do you mean by member? Member क्या होती है बताओ? Member means it is a part of the body which has a distinct function. Like example, say a thumb. Thumb. So thumb is a member of the body. Ear is a member of the body. Nose is a member of the body. So, privation of any member or joint, including joint, that is the 4th. Remember 4th clause, that is member. Remember 4th member. Remember now, emasculation, you know that. Permanent privation, eye. Permanent privation, that is clause number 3, that is the ear. 4th is the member or joint. Now here a question can be asked in Viva. Nail, is it a member? Hair, is it a member? No. So the nail and hair, they can regrow. It is not considered as the member. What do you mean by member? Any part of the body which is capable of performing distinct function, it is not able to regrow. This is the word you need to mention in the Viva. So there are 4 clauses we discussed, right? Now just examples now. Look at this. What is this clause? This is clause number 1. Right? Clause number 1. What is clause number 1? Emasculation. So when there is a damage to the testicles, cutting of the penis, or damage to the lumbar flexion. Example for class 1. Clause number 2, what you can see in the clause number 2 here, gouging out of eye, damage to the eye. Clause number 3, what you can see here, perforation of tympanic membrane. You can see the perforation in the anterior inferior quadrant. So this is can lead to deafness, right? Deafness. Clause number 3. Clause number 4, what you can see here, this is the amputation of thumb. Amputation of thumb is example for the member. The fourth one. Now we are talking about fifth clause. Before that, newspaper headline. What you can see here, wife kill a man by squeezing testicle. See here is very interesting. Squeezing of testicle can lead to death. So it can be punishable under murder also. So because of the vasovagal inhibition, question can be asked: what are the conditions in which vasovagal death occur? One example is that is injury to the testicles. Okay. This Supreme Court judgment is not needed for that level. Let's start with the fifth clause. Fifth clause, it is something related to power. And remember, fifth clause means power. So, power star. So what is that? Destruction or permanent impairing of powers of any member or joint. Any member or joint. Take example, foot drop or wrist drop, or say example, bone contractures. Bone contractures. Bone contractures. Then sixth one, it is something related to your face. Sixth sense, that is face, right? Permanent disfiguration of head or face. That is the sixth clause. So an example can be vitriolage, acid throwing, or cutting the ear. So that can lead to disfiguration. Seventh, that is related to the fracture. So any fracture or dislocation of teeth or tooth, that comes under seventh clause. Seventh related to the eighth one. Very important one, dear students. This is the area you tend to do mistakes. Eighth clause. What is the eighth clause? Can you guess? The eighth clause, that is having three important keywords or three important parts. Some books gives 3 parts. Some says 3 important keywords. What are 3 keywords? Any hurt which endangers life. This is important here. Important point. What do you mean by this endangers life? Remember, stab injury over abdomen. Stab injury over abdomen, it comes under endangers life, a dangerous injury. Or stab injury over the neck, leading to laceration of the platysma, can be dangerous injury. Yes or no? So the first keyword is endangers life, or which causes sufferer to be during space of 20 days in severe bodily pain. Severe bodily pain for about 20 days because of the trauma, because of the assault, or because of the hurt. So that is grievous hurt if it is for 20 days. Or unable to follow his ordinary pursuit for about 20 days. Because of the injury, because of the hurt, when the person is unable to do his ordinary pursuit, like example, say taking bath, having food, brushing teeth, all these are ordinary pursuit. Okay, so again I'll repeat. So there are 8 clauses. The 5th clause, that is related to the power. Example is contractures, bone contractures. 6th clause related to disfiguration of face. 7th, that is related to what is 7? Fracture dislocation. 8th one, that is related to 3 important clauses. What are they? Subclauses. Endangers life, severe bodily pain for 20 days, unable to follow ordinary pursuit for about 20 days. That is the 8th clause. So here are some important keywords. What are the important Viva questions? May stay in hospital for 20 days. Will not be grievous hurt. Simply admitting in a hospital for about 20 days. Doing all ordinary pursuit very easily. That can't be a grievous hurt. May stay in hospital can't be a grievous hurt. Ordinary pursuit means day-to-day activities. What are they? Going to toilet, having food, taking bath, wearing clothes. And remember, it does not include professional activities. Like example, running or jumping or going to work, driving a vehicle. All this doesn't come under grievous hurt. So all this can be asked in your. Now we are talking about, yes, weapon examination. In some universities, in some universities, they ask about the weapon examination. How to write proper weapon examination. Before that, some important questions now. Can you identify this weapon? Can you identify this weapon? Yeah. So KDT, when will the video updates of CRPC, IPC, BNS, Yeah, we are going to discuss this by next to next Friday. Next to next Friday, we are planning to discuss all BNS, BNSS, and also BSA. Okay. Yeah. Yeah, weapon examination. What is this weapon? Can I identify this? This is heavy weapon. Okay, this is heavy weapon and a dangerous weapon. It can lead to sharp wound. What is this? Sharp wound. Deep gaping wounds, we say. So this is your heavy cutting weapon. This is axe. So how to write weapon examination certificate? That can be asked. Second thing, what about this? This must be, what is this? This is again dangerous weapon. This is chopper, heavy cutting weapon. It is a cutting weapon. Okay, dangerous weapon again. What is this? This is hammer. What is hammer? Hammer is a blunt weapon. Okay, it has a blunt, it is a heavy weapon having small striking surface. It leads to one important fracture. Okay, remember that, that is depressed fracture, a signature fracture. Signature fracture. So now let's see weapon examination. They're talking about weapon examination. In exam, in CPM exam, it carries 5 marks. 5 marks. So any doubt you can ask me in between. So Mr. KDT and others, have any doubt you can ask me in between. Weapon examination, again, what you need to write: addressing investigating officer, reference, and the subject. You need to write. Second thing you need to write: details of the receiving weapon from police and date and time of exam. Name and type of weapon, weight of the weapon, to weigh the weapon, description and dimensions of the weapon. Finally, the opinion. Again, there are 5 parts. Weapon examination, all these are 5 parts. Let's see one by one how to write weapon examination certificate. The first thing, addressing IO, reference and subject. Okay. Now look at this. This is how we write the classical examination of weapon report. You need to write letter number. What is the letter number? There will be some letter number like 24 bar 2024, like that. Okay. 24. Date of that letter. To whom it is? To investigating officer. PS. What is PS? Police station. Subject regarding examination of given weapon or article. Reference number. So there will be a requisition from investigating officer to give weapon examination. You need to write that letter number and date of that and police station. Okay. So what is important here? You need to write. You need to maintain chain of custody here. So you need to write in reference to above case PM report. Sometimes it can be PM report or it can be injury certificate also. Received a seal packet bearing a number and seal of police station for examination of subsequent opinion. Sometimes they'll give you case diary, PM report, MLC report, FSL report or any other document. Whatever you document you receive, that you need to document in the your letter. That is important. Is to just to maintain chain of custody. Next proper examination. Like example axe, you need to write name of the weapon. What is the name of the weapon given? Axe. Type of weapon, heavy weapon. It is a heavy weapon. Hammer is also a heavy weapon. Knife is a light weapon. Blade is a light weapon. Made up of dash material, metallic or non-metallic. What are the parts? If any parts you can mention. Weight of that weapon. Blunt or sharp. And also you should write some opinion about edges. Whether single-edged, double-edged, serrated, non-serrated. All this you need to write. All this you must write. So you can see here, this is the sharp end. This is the sharp, relatively sharp. Then whether they are pointed or non-pointed, whether hilt is present or absent. If lati is given or some bamboo is given, rod is given, then you need to write some important opinion about number of notes and the length of the lati or bamboo, width of the bamboo, number of notes and distance between the notes. Or if any finding like any stain, foreign material, rust, any print design that is present on the axe or the weapon, that you need to write. And also you should write the diagram. You should write some important diagram, some related diagram of the weapon, that is hammer, axe, chopper, a blade, anything that is. Write the dimensions. Then finally the opinion. Opinion of weapon examination should be given like this. After examination of above mentioned weapon, examination over, submit a document. I am considered opinion that injury number found on the body of deceased as mentioned in injury report or PM report could be possible or could not be possible with a particular weapon. That you need to mention. So, opinion whether injury mentioned in the PM report or injury certificate could be possible with this weapon or not possible. Like example, axe can lead to abrasion, it can lead to contusion, it can lead to chop wound also. But what about firearm wound? Can it cause firearm wound? No. Firearm wound is not possible with the axe. Like iron rod can lead to abrasion, contusion, laceration. It cannot lead to some injury like incised wound or stab wound usually. So whether injuries are possible or not possible with that. Second thing, lastly, weapon should be resealed, handed over to police for further investigation. So remember, all this is very important. You need to maintain chain of custody all the time. This is your duty. As a doctor, you must know how to maintain chain of custody. Finally, date, name and signature of the medical officer and the seal. So this is how you should give weapon examination report. Okay. So lastly, we are talking about some important Viva questions. Let's see. Now, Viva voce questions. What are common Viva voce questions? The first question can be asked, what are important BNS? Like, what do you mean by hurt? The question can be asked. Hurt. The hurt is defined under section 114 BNS, Bharatiya Nyaya Samhita. What do you mean by hurt? Whoever causes bodily pain or disease, infirmity is said to hurt. So now it is defined under 319. No, 319 is hurt. It is going to be changed. It is going to become 114 BNS. Our question can be asked, what is 115 BNS? 116, that is grievous hurt. 117, voluntarily causing grievous hurt. 118, voluntarily causing hurt or grievous hurt by dangerous weapon or means. So this can be asked in your upcoming exam. Second important Viva question. What do you mean by dangerous weapon? Remember, any weapon can be dangerous, but usually dangerous weapon is the one which is used in cutting purpose, shooting purpose. Okay? You can see here, any weapon that is used in shooting, stabbing or cutting or any corrosive substance, like example H2SO4, acid or any explosive substance or the snake venom, a venom of the animals, so that can be dangerous weapon. This can be asked in your exam. So question can be asked, beta, what do you mean by dangerous weapon? The answer should be like this: shooting, stabbing, cutting, corrosive substance, explosive substance, or the venom. Then, what are the examples for dangerous injury? The question can be asked. What do you mean by dangerous injury? So, as we discussed before, stab injury over abdomen, neck injury, head injury, penetrating injury to the neck, stab injury over the abdomen, rupture of internal organs, liver laceration, spleen laceration can lead to hemorrhages and death. Or sometimes thrusting lathi into vagina anus, which can lead to vasovagal inhibition, can be a dangerous injury. So, or hemorrhage more than 1 liter, or bone injury more than 1/3 of body surface. All this can be dangerous injury. Sometimes the question can be asked, what do you mean by dangerous weapon? What do you mean by dangerous injury? This is the Viva question 3. Lastly, Viva question 4. What is Ong-Baker pain scale? We discussed now severe bodily pain. There should be some scale for severe bodily pain. That scale is known as Ong-Baker pain scale. Starting from no pain, that is 0, and very severe pain, which hurts the worst, that is the 5. So, sometime in exam, this question can be asked. What do you mean by Ong-Baker pain scale? It defines the severe bodily pain. Then the question can be asked, what do you mean by ordinary pursuit? Discussed already: brushing teeth, shaving, going to toilet, taking bath, wearing clothes, combing hair, taking food. All these are the ordinary pursuit. Remember, these are all very commonly asked simple questions in your Viva voce examination. And there is a question for you at the end. There is a question about Gabbar Singh. You need to answer the comment section. The question I am going to read now. Gabbar Singh causes scratch abrasion on Amitabh's cornea. Scratch abrasion. The scratch abrasion over cornea. Any abrasion over the cornea can lead to permanent vision loss. Clause number 2. So, in this case, there was a permanent loss, permanent vision loss. But here, very interesting, Gabbar Singh offers corneal transplantation, and Amitabh's now he able to see very clearly after corneal transplantation and true about above scenario. Option A, Gabbar Singh is not guilty as he agreed to pay expenses of corneal transplantation. That is option A. Option B, he is not guilty as vision loss is temporary and partial. Option C, Gabbar Singh is guilty of hurt. Option D, Gabbar Singh is guilty of grievous hurt as per 116 BNS. So write your answer at the comment section. So this completes the today's Forensic Friday series. In next class, we're talking about drunkenness certificate. Thank you. Wish you all the best.